Okay, so the final part of this talk is probably the most important in that it talks about the relevance of threshold concepts and why we even bother studying them in the first place. So the idea is that once we've identified threshold concepts, we will then be able to either design curriculums and teaching activities to help our students navigate through that sort of liminal space. It also makes the troublesome aspects of learning these concepts much easier. And this is really important because this is kind of that crucial time period where students can easily switch off. They can also leave with really awful misconceptions, such as the ones that we saw in psychiatry. This really influences how they think and engage with these types of patients. So it has quite long-term implications in terms of practicing, but also as a practitioner as well, in terms of identity formation. It means that students are left, with very incomplete understandings. And so there's a real drive to ensure that students are, successfully navigate this, unsure and unsafe space. So from a couple of examples from some of my research, these are some of the ideas that I came up with. Now, we've not actually tested them, so for all we know, they might not work at all. But essentially, I explain the rationale behind coming up with them. So I thought that understanding the role of a psychiatrist was particularly important in learning about the biopsychosocial model, but also in understanding the role of therapeutic risk-taking as well. So understanding that actually a psychiatrist does have to delve a little bit deeper and be a bit nosy and ask about these social aspects of care, which, a regular practitioner may not be as involved in. And so I thought understanding this role would help both understand biopsychosocial model, but also therapeutic risk-taking, as that's very much in the remit of a psychiatrist and sort of, a huge consideration day to day. So I thought understanding that would help them in their transformation, and more in terms of kind of a role transformation. I also thought that patient narratives are really important. So making diagnostic more reasoning, more explicit. So for instance, coming up with how you come in one admission, how you come to a conclusion about a diagnosis, and how looking through the notes, seeing that changes in the second admission, maybe in the third admission, maybe 5 years down the line, your diagnosis would change based on all of the different presentations within that time period. And finally, exposure to variation in patient presentation. So understanding that, in patient one, this may present in one way, and that's why you have one diagnosis, but in, another patient who presents in a different way, even though it may seem similar, your diagnosis would be different. And so these are a couple of things which I came up with. So this is very much a testing ground for coming up with different things, and I guess it is a sense of trial and error. And I think a really, a good educator, a good teacher is, someone who's willing to adapt to their students and willing to really think about the things that students struggle with. And I think that's a really good starting point when coming up with teaching activities, is to look at what's most troublesome to learn. And out of all the threshold concepts, I focused on the transformative and troublesome areas the most. So essentially, the exercise that I'd like you to do in the discussion forum is to think about areas within your own discipline, and think about the teaching activities that you've done, and think about which aspects, which topics have students struggled to understand the most, and have you adapted your approach at all in teaching them, sorry. And if you had to come up with another teaching exercise, knowing the areas that they struggle in, would that be different? So really using the troublesome characteristic as the starting point for creating teaching activities, which I think is a really good way. Perhaps beyond the other characteristics, I think if something is troublesome to learn, once they've learned it, it probably will be transformative. So I guess really the task is to think about, and this might have an overlap with your assessment, but it's to think about the areas in your own field that students struggle to grasp, and perhaps consider whether they meet other criteria that makes threshold concepts, and what you could possibly do. And so why do we care about threshold concepts? Well, I guess, like we say, the idea is to identify areas that students get stuck in and create teaching resources to help students. And this is essentially the starting point that I use, which I would suggest as an experiment. It would be, a good thing to start off with. Thank you. And that's the end of the lecture.